Okay. Welcome to the Health Literacy Awareness course presented by ESNEFT Library and Evidence Services. And today your presenters will be Janet Bayliss and Yulia Norkovini, assistant librarians at Colchester Hospital Library and Ipswich Hospital Library. I'm going to get going, and in a minute, I'm going to turn my camera off so you can't see me. But anyway, we wanted to say hello and welcome. Anyway, so acknowledgements is mentioned throughout this presentation. The Health Literacy Awareness course is specifically aimed for the training and development of public library staff, and this has been created as part of Health Information Week 2023 and as part of an Inspiring Better Health event. Health Information Week is a national multi-sector campaign promoting high quality information for patients and the public. It takes place from the 3rd of July to the 9th of July this year, and it covers the following themes: health literacy, mental health and well-being, women's health, social prescribing, children's health, cost of living and shared decision making. And for more information, please visit the Health Information Week's website. And the website is at the bottom of the screen there. Right, now the objectives and aims of this training session are as follows: to increase the understanding of health literacy and to raise awareness of how low health literacy impacts on the well-being of individuals. And finally, to give an overview of resources that are available to support people with low health literacy. The session will cover what health literacy is, what are the types of health literacy, and ways that you can begin to help your library users with their health literacy needs. We are going to start by thinking of literacy in general. Here is a question for you to have a think about. What do you think is the average reading age for an adult in the United Kingdom? Now, yes, some of you may be surprised to know that the average age is just 9 years old. And this is some information from the Office of National Statistics in 2017. It is vital that we are aware of this in our daily communication with our users. So let's get started with our introduction to health literacy. Now, based on the information provided on the screen, are you able to provide a 2-sentence summary of what we mean by health literacy? Have a look at that. Have a think. How do you feel while reading this slide? And here, we're using this slide as an example to show how frustrating and difficult it can be to understand the information when you're not familiar with the subjects and when you can only make sense of part of the information supplied. And I think there you can see various bits, various words look a bit familiar, don't they? Okay, now just moving on, that previous slide actually was a definition of health literacy. And basically, the following is the most widely used and has been adopted by the World Health Organization. And it comes from some Australian research by someone called Dodson, and it states that health literacy is the personal characteristics and social resources needed for individuals and communities to access, understand, appraise, and use information and services to make decisions about health. So, in a nutshell, health literacy could be said to be a person's ability to access, to understand, and to act upon health information. And we're using the term health here in its broadest sense, from particular health behaviours, i.e., related to food or exercise or smoking, to the other end of the spectrum, serious clinical or medical conditions. Now, according to Professor Nutbeam, who has written very much and very copiously on health literacy, there are three types of health literacy: functional, interactive, and critical. And this is from an article which he wrote, which will be on our website and also on the handout. Functional health literacy is the first type. This is a person's ability to read and comprehend information and instructions in health settings at the most basic level. So it concerns the basic reading and writing skills needed to understand everyday health information. For example, reading prescriptions, medicine labels, and instructions. Now, there's two other types of health literacy. There's interactive health literacy, which, in order to correctly interpret and balance the information provided and make decisions about health and social care, then higher level skills are needed. Interactive health literacy can be defined, as it says on the screen, as a person's ability to be actively involved in decisions about their health and care over time and in changing circumstances. It basically, to have interactive health literacy, you need more advanced cognitive and literacy skills and also confidence. And therefore, you will be able to discuss and actively participate in your health and treatment options with healthcare professionals. And then there's a final level of health literacy, the highest level, which is critical health literacy, which is basically a person's ability to take control of the wider determinants of their health. And that might be to do with the environment, or to do with social situations, or to do with psychology. So it's the ability, in a nutshell, to appraise and challenge information and to understand the links between health outcomes and broader social, cultural, and also economic factors. So critical health literacy is basically the most advanced level, allowing individuals to analyze information critically and take control over those determinants. For example, identify health risks in the environment and taking action, maybe finding some pollution somewhere and then knowing who to contact in terms of local authorities or organisations to get it sorted. Right. So why does this matter? So why are you listening to this today? Now, I would say that health literacy has never been more important than it is now. And if you think about things post-COVID, it really brings it home. Now, the Community Health and Learning Foundation estimates that between 15 to 21 million people in the UK might not have the level of skills that are needed to lead a healthy life. So health life expectancy has been improving and people are living longer, but life expectancy is increasing faster than time spent in good health. And this will impact on people's quality of life and increasing pressure on the health and social care system. So thinking more further, why is health literacy relevant to us? Now, a study by Newcastle University and Aarhus University in Denmark was done in 2015 by Professor Jill Rowlands, which showed that in England, 43% of working age adults, that is, aged between 16 to 65-year-olds, were unable to understand or make use of everyday health information. Now, when numerical information is taken into account and numeracy skills are also considered, this number rises to 61% of 16 to 65-year-olds did not understand health information comprised both of text and numbers. Now, that really makes you think, yeah, that's over half of the adult population. Now, in order to break this down a bit, this map shows the national percentage of working adults, the population for whom health information is too complex. And you can see, broken down into regions, that in the East, 35% of the adult population struggle with health information. And that's a bit better than nationally, but still not great. Now, if you take into account the regional component for numeracy, then the amount of people who find health information too complex rises to 55%. So, yes, it's still better than the national average, but it's still a very significant number of 16 to 65-year-olds struggling in our region. Now, these maps show an estimated prevalence of low health literacy and numeracy for a couple of chosen local authorities, being Colchester and Harlow. And this indicates the percentage of the population aged 16 to 65 who are likely to have difficulties in understanding or interpreting health information. So in Colchester, it's 56.34% would have difficulties, and it rises to 66.75% in Harlow. And this is taken from a website called healthliteracy.geodata.uk. And if you go to that website and type in details of your local authority, you'll be able to find out what the position is for yourselves locally. So now, health literacy affects all of us. Now, most people will have health literacy needs at some time during their life, regardless of skills. Now, factors that can influence this are possibly stress, becoming a new parent, getting a really scary diagnosis, and in these circumstances, even the most well-educated people may struggle. And I've got here a quote from Professor Tricia Greenhalgh, who started as a GP and is now Professor of Primary Care Health Sciences. Now, when she was diagnosed with breast cancer in 2015, she admitted that the first thing she did was put breast cancer into Google. And she said, because you're frightened. So it gives you the perfect example of how health literacy affects everyone, no matter who you are. Food for thought, I think. So individuals with low health literacy are more likely to die younger of preventable diseases. They have a higher prevalence of long-term conditions, which long-term conditions are more likely to be limiting. Also, people with low health literacy are less likely to engage with disease prevention, cancer screening, or immunization. They're also less able to self-care. They will have more unhealthy behaviors, including alcoholism, poor diets, obesity, and smoking, and fewer healthy behaviors, such as a good diet, normal weight, taking the right amount of exercise. And they will also have a lower response to public healthy living campaigns. People with low or limited health literacy, and I think this is a great shame, are more likely to report a sense of shame about their skill level. In addition, limited health literacy has also been found to be linked to great distrust of medical professionals and a more generally negative attitude towards health and healthcare. And I think this was particularly highlighted during the last few years and the COVID pandemic. So now here, I'm going to give you a couple of examples of problems caused by low health literacy. A woman who thought that chemotherapy would not help because it was given into a vein on the other side of the body to where her cancer was. A woman who sprayed her inhaler on her neck because she'd been told to spray it on her throat. And if you think about it, that makes a sort of logic there somewhere, doesn't it? And most interesting to me was a patient who was taught how to inject his insulin into an orange and who came away believing that he needed to purchase oranges, inject them, and then eat them in order to get the insulin into his body. Again, you can see a sort of logic there. So it's all about communication. Now, We've talked about the effect of low health literacy on people. Now, on the other side, there is the massive cost to the NHS of low health literacy. Now, in 2017 to 2018, it was estimated that low health literacy cost between 3.7 to 6.2 billion pounds. So that's a huge amount of money. And this can be broken down to missed GP appointments costing 216 million pounds per year. Wasted medication adds up to 300 million pounds per year. And missed outpatient hospital appointments. And these come in at £120 each, multiplied by 8 million. So do the maths. We're talking big, big figures here. So it does have a huge impact upon people, upon society, and also cost to the NHS and cost to the country generally. Now, obviously, having better health literacy will reduce costs. So, as mentioned before, low health literacy has got a clear association with poor health outcomes. So, improving health information and simplifying health communications can help reduce the problems associated with low health literacy. Also, we need to support the development of health literacy skills, and particularly for those of the most disadvantaged groups. Now, it can be said that engaging groups at a risk of limited health literacy will enable them to become more literate, and that has the potential for positive social and financial impacts. And for example, costs to the NHS can be saved if people are enabled to seek out information to help them better manage their own health and well-being. Simple, really, isn't it? Simples. And obviously, as I say, if you develop your health literacy skills, confidence and health literacy will improve. Now, good health literacy is vital if people are to be empowered to be able to protect and improve their own health and well-being, and to make sure they're getting the services that they need. So it can, and as listed there, save time, improve practice, improve patient care, satisfaction and safety, and also ensure more effective use of resources as well. Basically, in a nutshell, saving money and obviously making people's lives better. Now, I'm now going to hand over to Julia for the second half of this presentation. Thank you.
Thank you so much, Janet. We are going to talk about how to find trusted information. So, how can you help your users when trying to find health-related information? Here are some steps that you can follow. Question: what do you need to know? What is your inquirer interested in? Make sure that you ask open questions and keep checking what they mean. This process may take time. It is very important to try to establish your user's literacy level, as this may not always be evident in initial discussions. Some people may choose not to reveal their literacy difficulties. These will be particularly evident in areas of poor health status. Try to be quite specific when you ask for further details. For example, if someone asks for information on dementia, are they really looking for information on local day centers for a parent, information on how dementia is assessed? Or are they concerned that they are showing signs of having the condition themselves? You can only give a relevant answer when you know that what the person is really wanting and what they need. Another one is the source. Where will you look for information? The internet has a wide range of information from all over the world, but you can get far too much information. It may be difficult to ensure accuracy. Many organizations have their own websites which provide specific information on a range of health and social care issues. Remember, you need to decide if the information is from reliable source such as the NHS or other government source, or maybe a recognized voluntary organization or a support group. Also evaluate is the information good? Is the information accurate? How do you know it? Is the information from a trusted source? Does it come from NHS or other government source, a voluntary organization or support group? You need to take care when searching the internet. Many websites are commercially sponsored and the information could be incomplete or biased. Does the information cover what it says it is going to do? Do you think it is relevant to your inquirer? What makes you think that? How up to date is the information? Check for dates on leaflets or when the website was last updated. Is the website easy to use? Is the layout clear, attractive, colorful? Is the language appropriate? Is it plain language, jargon free? Who is the information aimed at? Young person, adult, clinical staff? Is the information relevant to the local area? Is it available in a range of languages and or different formats so that it is accessible to everyone, including deaf people who use BLS? And finally, signposting. It may involve suggesting a range of national and local information sources which may be relevant. These may include, for example, websites, learning centers, patient information centers, advice agencies, and support groups. Remember to be aware of literacy issues when you are signposting. Be clear about the limits of what you can and cannot do, and how can you safely help. Knowing when signpost the inquirer to a professional is very important. An inquirer will often ask for your advice. For example, what do you think I should do? You should not give personal advice or opinion, even if you are doing this with the best intention. It can be hard to know what information is reliable and accurate, as some of the information provided via different media channels can be false or misleading. And here are some definitions. Fake news. News or stories on the internet that are not true. They may be in the form of disinformation or misinformation. Disinformation, false information that's created and shared to deliberately cause harm. Misinformation, generally used to refer to misleading information created or disseminated without a deliberate intent to cause harm. Here on the screen, you can see an example of misinformation. In the newspaper The Sun, the heading, Green with Envy, I lost 8 stone drinking green tea, suggests to the reader that green tea can help you lose considerably the amount of weight. And subheading, Samantha Rees claims drink took her from 17 stone to 9 stone in a year, further confirms this perception. However, if you paid attention and read all of the article until the end, you might have noticed that Samantha's diet has also changed. This contributed to the weight loss. So assumption made in the headlines that Samantha lost weight because she drank lots of green tea, not because her diet has changed, is misleading. So how do you know if the health information you are reading is reliable? Is it evidence-based? Think about 3 Ws: who, what, where. Who wrote the article and why? What are their credentials? Are they qualified to provide this information? Is it from NHS or trusted charity? Is it relevant to UK medical practice? When and where was it written? Is it still current? Has it been recently updated? Can you track the source? How did they get the information? Is it reference? Is it based on medical evidence? And is it sponsored by anyone who might have a commercial gain? Does it seem too good to be true? The most negative consequences of health misinformation are the increase of misleading or incorrect interpretations of available evidence, impact on mental health, misallocation of health resources, and an increase in vaccination hesitance. Four studies reviewed in the World Health Organization paper entitled Infodemics and Health Misinformation, it's a systematic review of reviews, looked at the proportion of health misinformation on social media and found that it reached up to 51% in posts associated with vaccines, up to 28.8% in posts associated with COVID-19, and up to 60% in posts related to pandemics. Among YouTube videos about emerging infection diseases, 20 to 30% were found to contain inaccurate or misleading information. Generation Z and millennials turn first to social media platforms to find out health information. YouTube and Twitter are the most popular social media sources for millennials, and Instagram and Facebook for Generation Z. This is concerning because the content is not peer reviewed or checked, and so it can offer false information. Social media therapy or Instagram therapy is becoming more common, described as where everyday people post quotes from their counselor or general advice about mental health. While this can be helpful, these posts are typically written by those with no mental health training and shouldn't be used as a replacement for actual therapy. One of the main risks is that the advice is often very general, and that means that it will not be helpful or appropriate for everyone. Also, not everyone who posts on social media has their viewers' best interest at heart and can harm people's mental health. These posts are unregulated. Posts only provide a snapshot of information where problems are often oversimplified or cause pressure to look or behave a certain way. Google. Google can be an easy way to find information, but it lacks judgment and can provide us with information that has no relevance or little accuracy to your query. This can quickly send you into a rabbit hole that gives you false information and an incorrect diagnosis, leading to increased and potentially unnecessary anxiety, and so it leads to more Googling. It creates a vicious cycle. The anxiety this creates has been termed cyberchondria by psychologists. When your anxiety increases due to health-related searches. Not only can this affect your mental health, there is also the issue of reliability of the sites that you find and rely on to give you a quick and easy diagnosis. While some sites are correct and informative, and we will talk about those later, about 50% of the sites that you come across via Google are not reliable enough for you to use to find health information. Here are some practical tips on finding trusted health information. Listed first on Google is likely an advert for commercial company. Anyone can pay to have an ad on Google, and these will often be promoted at the top of search results. While Google say they vet these, which conducted an investigation and were able to advertise a fat burning bottle of water from a company that was completely made up and were required to provide no proof that they existed. Google Advanced Search, you can use site or domain field to filter to nhs.uk, gov.uk, ac.uk, and also date filters. Avoid websites that are someone's personal website. If there is an About Us link, review the purpose of the organization. If the purpose is to promote commercial products or services, the health information provided may not be trustworthy. Is there a contact information for the organization, such as an email or phone number, so you can contact them to learn more about the organization or website information? Also, be careful with links. If a link on a trusted website directs you to an entirely new website, do not assume that this new website has also trustworthy information. You will need to evaluate the new website to ensure it is trustworthy. Is the information up to date? Look for the phrase last updated on the web pages to see if the pages are current. If there is no indication of when the information was last updated, then do not assume it is current. Look for other indications that the website is not up to date, such as an outdated events page or outdated news under latest news feed. If links on the website do not work, the website may be outdated. Try to apply critical thinking. Is the information presented based on facts, evidence? Does it sound too good to be true? Be skeptical of health information that contains claims of a miracle cure. Look for indications that the information on the web page is based on research or expert review and not just opinion. Are research articles or other original sources of information cited? Is there a clear statement of where the information presented comes from or how it is reviewed? Compare the information you find on one credible website with information on other websites to see if it is consistent. Also verify health claims that are based on personal testimony through multiple credible sources. Online support groups, forums, or blogs, they are a great way to share experiences and information, but should not be considered as a trusted source of health and medical advice. Try to evaluate the strength of the health claims presented. For example, a health claim based on one small study is not as strong as health claim based on the findings of multiple large-scale studies. We have some resources to share with you and you can share these resources with the public. The World Health Organization provides tips for spotting misinformation and disinformation. The World Health Organization's Kahoot quiz, it aims to help people identify the red flags of misinformation. The Piftic is the website that has one-page posters which are free to view and download on topics including false health information, warning signs, and what to look for in trusted health information. Independent Age offers advice on how to find reliable health information online. Here is also a list of trusted websites. Everyone knows about NHS website. It offers a wide range of information and resources on health and wellness. It includes information on conditions, treatments, and self-care. And also there is NHS app, again, health advice amongst services offered. UK Health Security Agency and Office for Health Improvement and Disparities provides information and resources on public health issues, including health literacy and wellness. It's previously known as Public Health England. Patient.info, a patient information website that provides accurate and up-to-date information on a wide range of health conditions and treatments. Health Literacy UK, it's an organization that aims to improve health literacy and promote better health outcomes in the United Kingdom. And there's also Health Literacy Place. It's a Scottish organization that aims to improve health literacy and promote better health outcomes in Scotland. The Health Foundation, an independent charity that aims to improve health and healthcare in the United Kingdom, including through promoting health literacy. The National Literacy Trust, an organization that aims to improve literacy in the United Kingdom, including health literacy. Health Talk contains patient stories and videos. Health Watch provides advice, information, and latest reports about health and social care. And locally, it's healthwatchessex.org.uk. Easy Health, an online library of accessible health information with simple words, their pictures, and films. Health information in other languages, available via American site called Medline Plus. And finally, there's Essex Wellbeing Service. Also, you can share some digital literacy resources with the public, such as Learn My Way. It's run by the Good Things Foundation, offers free courses to help people learn digital skills and stay safe online. And also there's the BBC's Webwise, is a series of short films introducing topics including using email, using internet, and online safety. Here are some resources to share with you, my colleagues librarians. The National Institute for Health and Care Research has evidence collection on health literacy that makes the case for improving patient information. It also includes tips on how to make sure everyone can understand the information they are given. The Patient Information Forum. It has a Health Literacy Matters poster that includes data to help you make the case for health literacy friendly materials. Libraries Connected offers online learning modules as part of its work on media literacy and digital skills development. The Information Literacy Group website supports practitioners and researchers from around the world with an interest in information and digital literacy. Finally, to summarize, health information is too complex for the majority of the population in England. People with lower health literacy have poorer health outcomes. Low health literacy uses up to 3 to 5% of the annual health budget. In 2020-2021, this qualified to 5.7 to 9.6 billion pounds. By working together to improve people's health literacy, we can help reduce this huge financial waste. Thank you so much for listening.